And welcome, everybody, to our daily COVID by the Numbers show. I'm Steve Irvin, filling in for Katie Rammel today, and we're going to be talking about the rising numbers in Arizona. We were not with you on Wednesday, so we're also going to be talking a little bit about some of the numbers that came out on Wednesday, specifically dealing with Maricopa County. And the news wasn't good, especially for zip codes and also translated into school districts as well, although a number of school districts do remain open, despite some of the numbers suggesting that they need to move at least toward a planning stage for virtual learning. Joining us, as always, of course, is our data guru, Garrett Archer. Let's start with, I guess, the numbers that we have today. Monday's typically pretty slow day, not necessarily reflective of the trends that we're seeing. And you and I were talking earlier, that's somewhat amplified a little bit because of the Thanksgiving holiday. Talk a little bit about that.
So if you look at today's report on AZDHS, 822 cases are in the system today, and that's a very low number. However, it is a Monday, and it's a Monday after a holiday. So because of that, we're going to have a very low number today. We could have not a low number tomorrow, but it might take a couple days to see what the actual sort of numbers are from the Thanksgiving weekend, just because of administrative staffing issues. They don't have a full staff during holiday weekends, and so it's harder for them. It takes them longer to research some of this data. So it does appear right now that we have some low numbers, but really when you look into the data and you look at sort of the epi curves, we could have as high as 3,600 cases today. Let me just double check that, but it could be much higher than that. I'm waiting for AZDHS to clarify something. If you look at, say, the percent positive of cases that came out today, and versus the case number itself, that percent positive was much higher, and it usually doesn't sort of divert, or it doesn't split off from cases as much as it did today. Typically, it's only usually a couple points off here and there. It was off by a good amount. So I'm waiting for AZDHS to tell me if the case number is artificially low, or if it's a lot of duplicate tests that were considered positives that are going to be removed tomorrow, and that's why they weren't put into the reported summary number. I'm not sure what it is quite yet, but we'll find out as soon as possible. In fact, it'll show up tomorrow no matter what, probably.
So we had a lot more testing, especially right before Thanksgiving, and we reported on some of the long lines that we saw at some of these testing sites and that sort of thing. And so some of the rising case numbers can be due to more testing, which is where we sort of look at some of the other numbers to see just how much this virus is spreading. And a couple of the metrics that we use typically are the transmission rate, the R0 number, and the percent positivity. Give us an idea what some of those trends are showing.
So I'll go over that as well right now. I'm just showing you what you're talking about here. As you can see, this is our last peak, 5,400 on, this is date of collection, 5,400 on June 29th. We have November 23rd right now at 5,000. But you can see sort of, if you look at the pattern of these increases here, you can see a pretty significant week-by-week increase from November 12th to the November 20th that week, and it still is continuing. So we're likely to see these numbers, which are artificially low right now, are going to pop up into this 5,000 range very likely. So just sort of be forewarned at what could happen in the next couple of days. It really should see more numbers that are closer to this 5,000. So on to the testing. When we look at the percent of positive tests, this is what we're talking about. Right now, we've seen sort of this increase in percent positivity. We have this extremely high number of tests right here, 160,000 tests done for the week of November 15th to the 21st with a 12% positivity. Right now, we're at about 107,000 tests with a 14% positivity. So as you can see, right now, our percent positivity is still trending upward by at least either 1 to 2 points every single week. So again, we are testing more, but we're also finding more positives in these tests.
And that gives us a good idea that, in fact, the virus is indeed spreading, because we're not only getting a lot of positive tests, but we're getting more of those tests coming back positive in terms of the overall number. And the R0 number is the other number that we have sort of looked at as we've tried to to look at this. And for those who may not know what the R0 number is and how it's sort of calculated, we always sort of focus on the number 1 with that number, and anything below that number is trending in the right direction. When you start getting above that 1 number, then you start to see a rate of transmission that becomes concerning.
Correct. So it's, as I like to say it, like you said, with the 1. So a 1 represents 100 people in Arizona. So if 100 people, if our R0 is 1.13 as it is today, that means that 100 people can spread the virus to 113 people. So that's why it's increasing on a regular basis. And as you can see with that 1.13, we are in the sort of the top tier right now. You see Oregon with a 1.5, which is just massive, but we're about 7 down from there. We're the 43rd highest state or something to that effect right now. So just something to consider. We've had this RT for quite some time. If you've been watching this show, you've known that when we've been reporting this, we usually report the RT every single day, and it's usually around this 1.14, 1.13 range. So really, it's what we're seeing is our R0 isn't really changing. There's some of the other states are changing around us though.
And so that puts us ranked about 7th in the country right now for transmission of the virus itself. And has this been trending up as well?
The RT itself has been about this 1.13, hasn't really changed too much. I'd say if we look at the actual way it's calculated, it hasn't really changed. As you can see, they think that on September 9th, we crossed into the 1, and then we've been at 1.12, 1.13 essentially since October 1st. So that's sort of how stable things have been in Arizona. Now, unfortunately, the stability has been in an upward trajectory, but that's what they sort of think right now, is this is how long our stability has gone. Now, of course, it's hard to see, but if you see those error bars here, and so obviously there's a great deal of uncertainty as you get farther out. So when you get up to here, there's a lot more uncertainty as if the stability should be there or if our RT should be growing or shrinking.
So as we've been telling you for the last 10, 11 months or so now, I believe, well, not quite that long, about 8, 9 months or so, we look at, we start to look at when we see these numbers increasing, especially the number of positives that are coming back and so forth. We start to look at hospitalizations, and we also start to look at the number of deaths. And the main concern in all of this, I think, is that we're going to get to a point where hospitals become saturated, and then we have to get into crisis care standards and that sort of thing. And so when we look at hospitalizations and healthcare professionals have been warning us for quite some time about the number of hospitalizations and the number of people in ICU. How close are we getting to that point where hospitals are getting overwhelmed?
Well, what I can tell you is that based on the data that ACDHS reports on a regular basis, and I'll start with inpatient numbers, we're at about 70% of COVID-19 occupancy of where we were during this peak right here. So that means, if you look at this peak, we were at about 45% of people in the hospital beds were COVID-19 patients. This is not counting ICU. And now we're at about 29%. As you can see, the hospitals have been doing all they can to basically, as this number has risen, they've tried to make and afford as many beds as possible to compensate for the growing COVID-19 numbers. So they've tried to keep this as low as possible. Today, our headroom is about 86%. It's gotten as high or as low, if you will, as 89%, where that was, we only had about 11% headroom left. Today we're at about 14%. So they're trying to kind of keep that headroom around that sort of 10 to 15% range in the inpatient. And it's the same story with the ICU. In fact, you can even see the growth on this one a little more clear, as they got to a low in ICU right here at about 26% headroom in ICU, and now they're at about 11% headroom. And as we can see from our original peak, it got to about 9%, and then they started dropping off a lot of these numbers. So we're going to see what happens if they get to that 9% again. If they start, they're basically going to start, freeing up as many ICU beds as possible. So the hospitals are doing what they can to manage bed counts.
So when you say 14% headroom, that means we have out of intensive care units available, we have 14% of our ICU beds available.
11%
11%.
beds available, yes, right now.
So 89% of our ICU beds are filled right now.
Yes. And as you can see from this, at least since the summertime, we've been, for the most part, within that 80 to 90 range. It hasn't really dropped. You can see in initial reporting, it was much lower than that. But we've been in that 80 to 90 range for quite some time. And that has a lot to do with the elective surgeries. And also, when we talk to hospitals, they tell us that this is the time of year that capacity is more, there's more people in the hospital occupancies anyway. So because of that, they were expecting to see more people, but this is you can tell just by the way that this is managing out, how they're desperately trying to manage this line as this COVID-19 ICU number skyrockets, because they need dedicated COVID-19 floors. It takes more staff to deal with the COVID-19 patients. So it's just a lot more strain on the hospitals as these ICU numbers increase.
And we should say that in the last week or so, we've also done a lot of reporting, talking to medical professionals, people that run hospitals in some cases, medical directors and that sort of thing, who have said, one of the issues that we're dealing with this time versus say in May and in June and July, when we really started to see those numbers spike, was that in May and June and July, we could call for help. We could go out there and ask nurses to come to Arizona and work and man those ICU beds. And in many cases, we had nurses who were experienced in treating COVID-19 patients because they had dealt with that initial surge that we saw in places like New York City. In this case, it's a little bit different because unlike then, we're seeing this trend in almost every state. I mean, we're seeing this type of surge really across the country. It's hard to find a state that doesn't have rising numbers at this point.
Correct, and that is the and that's the conversations I've had over social media and other places with emergency room doctors and other doctors, is that is their concern as well. And these are some of the people that I talked to are also people that during the initial surge were a little bit more composed about what was going on. They understood that things were getting rough out there, but they also understood that they had the staff to handle the capacity. And these same doctors that I'm still talking to, I could just tell you, and this is anecdotally, of course, because I've only talked to a couple doctors, but these doctors are a lot more concerned in this time around than they were the last, simply because of the staffing issue. As you said, they don't know if they're going to have the staff for everything. And so they are much more nervous this time than they were in late June, early July.
And on top of that, of course, we got flu season as well, which typically raises those numbers that we see in ICU beds as well. So we've got kind of a double whammy happening right now. We've got rising numbers, we've got the flu season, and we don't have a lot of backup as well in terms of getting some of those folks in there. So when we let's tackle deaths, because I did mention deaths earlier as well. Maybe one of the encouraging signs is that we have seen low dropping rates of mortality. Let's put it that way.
Yeah, I mean, that's a good way of putting it, unfortunately, because when you talk about deaths, of course, it's very hard to find any good news in anything with deaths, because you're talking about a life, of course. But when we look at sort of the death numbers during this spike, so far we have not seen anything materialize that has been matching the first peak. Now, you must understand with deaths, it takes about a month for for example, for these days, November 17th, it's going to take about a month longer in order to see what this number truly is. And so we won't really know what this curve looks like for that amount of time. But with that being said, what we're seeing right now is sort of, if I look back at sort of the reported numbers, so I take out the actual dates and look at what it is, we do have a slightly less death rate right now than we did at around the same time of the last curve. So this is at least somewhat encouraging news right now.
Yeah, it is a little bit encouraging, and one of the reasons that's been suggested for that, as we've reported, is that doctors have a better idea on how to treat this when you go into the hospital. They've learned a lot about what the virus does and what it's likely to do, and because of that, when you go into the hospital, you have a better chance of survival. But again, the key is making sure that you can go into a hospital and actually get that sort of treatment is one of the big worries for doctors right now. So,
and also if you looked at, say, Maricopa County, and I'll just bring that up really quick just to show you the difference between this time and the last time. It has a lot to do with the long-term care facilities and how they've been handling it and how they're not as hit as hard as they were. When we look at the death numbers for Maricopa County, for anyone who's not in Arizona, this is our largest county. You can see that, and these dark green, as soon as it pops up, the dark green down here, this dark grayish, if you will, this is the long-term care facility deaths, whereas the light is, in the community. So if we sort of scroll back here and look at what things look like at the very beginning, you can see that in the very beginning, a lot, in fact, 70 to 80% of the deaths that were happening in Maricopa County were happening in long-term care facilities. And you can see how this was pushing up the death numbers all across the state, or at least the county. And when you get past the peak and you see where we are now, you can see that those long-term care facility deaths are not happening anywhere near as frequently as they did because of, just as you said, better understanding of this virus and how to control it from getting into the long-term care facilities. And that's one of the reasons why it's not, the death number isn't as high. It's because we've got a better handle of it in places that matter the most in many ways.
But the percentage of deaths among others outside of long-term care facilities, that's risen as well, which would suggest that we're seeing younger cases and younger people dying as well.
Yeah, there's slight increases in those numbers, but they're very slight. It is still mostly a situation in which people who die from this disease are in their later than 65 and also have one or more comorbidity.
So let's talk a little bit about the modeling then, because when we look at models and we start plugging all of these numbers into some of the different models that at least attempt to predict where we go, it's not a real encouraging sign. It's it's pretty alarming to be honest with you. And let's bear in mind that when we look at modeling numbers, we also look at a snapshot. They're plugging in the data based on the most current data that we have. The models can change, and they can change drastically when the numbers actually change drastically. And so, when we look at some of these modeling numbers, give us an idea where it at least says we are going.
So this has not been updated, just so everyone knows what we're looking at. This is University of Washington, and it has not been updated since November 19th. So just something to consider while we're looking at this. But here's where we are. As you can see in its modeling, it does believe that we're sort of on this, as we talked about, this is the death numbers, what it says is our total deaths. And it does believe that we're going to see a rise in deaths coming at around late December. That could be, as we talked about, that 28-day thing we're talking about. When we look at the daily deaths, I'm going to take out all of this because there's a lot of variability in that and just go with the projection. You can see the daily death, it does believe that we're supposed to be on an upswing as far as the number of reported daily deaths. That's going to happen until at least January 14th, and then it's going to start to subside. And then when we look at the estimated infections, again, taking out the variability, just looking at the projection, it does believe that right now we are sort of at the middle of what this new peak is going to look like. So this, as you can see with this particular model, it does believe that right now this is still our large peak. But it believes that we are going to far surpass that peak with this one that's going to peak itself at around December 27th or so.
So when we looked at some of the previous screen that you had brought up, it projects that we're hitting, I believe it was 14,000 deaths by late December, early January.
Yes, this one does think, if you look at late December, early January, it does believe that we're going to be at, it says, 8,000 deaths, 8,500 deaths in that time period. And then when you go to March, that's when it gets to 14,500.
14,500 deaths by March. So more than doubling the number of deaths right now. We've had 6,600 people in our state die. so far, and now we're up to 14,000 potentially.
No, yeah, of course. As everyone knows, this is modeling, and this is very far out. So as there's always variability and noise that happens when you model this far out. So that's why they have this number here, these error numbers that say we think it's going to be 14,005, but it could be as low as 11,000, and it could be as high as 18,600. So just to make sure everyone understands, that's why they have those sort of wide numbers where it can fall inside.
Can you address something, because I've seen this pop up in comments a little bit about this idea that when we're reporting COVID deaths, we're reporting COVID-related deaths versus deaths that are solely from COVID-19.
Yeah.
And it's interesting because if someone has, say, diabetes, and which is a disease that in and of itself threatens their life, it's kind of like COVID puts them over the top.
Yeah, and that's a very good way of putting it. I mean, there's been this sort of we addressed this a lot during the summertime. It came up a lot where people would say, "Oh, only 6%." I think it was the CDC. Someone looked at the CDC file, misinterpreted a data file, and said only 6% of COVID-19 deaths are from only COVID-19. And they said, "Look at that. See, like 94% of deaths are from something else, and COVID-19 it's only 6%." And that's just a misinterpretation of what the death certificates are actually trying to read. That 6%, what the CDC was actually telling you at that time was, look, about 6% of these death certificates are not fully completed yet, and they will likely be completed over time and be refilled in and researched, because that's how death certificates work. It's not like a lot of the stuff that we're used to on a regular basis. These are always people go back and research these, and rarely death certificates will almost never have only one cause of death on them. They usually have 2 or 3 cause of deaths. Even for something as simple as like a gunshot wound, there's going to be 2 or 3 cause of deaths. So when people saw, oh, see, these only 6% of death certificates have only COVID-19 in them, that is more suggestive of an incomplete death certificate than some sort of way that the pandemic is handling itself. Now, what you said, is it true that most of the deaths that come from this are coming from people with comorbidities? Absolutely. It's absolutely true. Although there are, like I said, it's about 83% in Maricopa County of people that either have a comorbidity or over 65. But there are other people, of course, that die from this thing that aren't just, they don't have just like a diabetes or something like that. But it's not just going to be COVID-19. They're going to die from something like pneumonia. They could be fairly healthy, but they're still going to get pneumonia. And that's going to be the cause of death, not just COVID-19. So that's just something to clear up.
And there are all kinds of these underlying conditions as they talk about it. Obesity is one of them that normally it's a manageable medical condition.
Yes.
But when you combine it with COVID, then it becomes deadly. And the same thing with the flu. It's normally something that causes it. The flu causes roughly 30,000 to 60,000 deaths a year in the country, but when you combine it with COVID-19, suddenly it becomes a lot more scary, a lot more deadly.
Yeah, so, and it's, like you said, it's things that are compounded. So if you get the flu and you get pneumonia, and it affects your breathing, and then it affects your cardiovascular system, and that's gonna change the diabetes. If you have a certain type of diabetes, that could put it over the top. So it's just like anything else. It's a chain reaction. It's not just, oh, COVID-19 and you drop dead. It's something else that is the chain reaction that causes it.
Yeah, and it goes for a lot of people. And there's quite a few people out there who have one of these underlying or pre-existing conditions, if you will, that could, combined with COVID, make them much more vulnerable to the virus itself. One of the things that we talked about when we started this particular program was, are we at a point where Governor Ducey is going to step in and issue some sort of additional stay-at-home order or some sort of additional restriction, like we've seen in several other states now, where in California there's a curfew, there's a ban on indoor and outdoor dining now. They've gone very restrictive with some of their orders. This governor has been really reluctant to do that. Taking the politics out of it, though, for a moment, can we look at where we were with our rising numbers when the governor did issue some of those orders back in late May, I believe it was, mid-June, I think it was when he finally stepped in and did some of these numbers, and where we are now, and just sort of compare them, because I think people would probably like to see some sort of consistency as to how the state reacts to some of these numbers, and I have to wonder if we're really seeing that sort of consistency. Is the governor, willing to do the same thing now that he was willing to do when the numbers painted a similar picture several months ago?
Sure. So when we look at, let's just take a look at some of my graphs, and we'll just walk through them. I do have one that I have to update that actually has sort of when the governor made his decisions, but we'll just use this one for now, because that one is not fully complete. But what we see is this, the stay-at-home order, the actual stay-at-home in Arizona actually occurred around this time right here, where case growth was extremely low. You can see, the actual percentage, of course, was pretty high, just based off of there being very low cases in Arizona. But the case growth itself, the raw numbers, were very low during the time of the stay-at-home order, which was lifted around this time right here. And that's when we saw a pretty significant spike in cases. As you can see, this is the run-up of our first peak. And then around this period right here is when Governor Ducey issued the mask order. And then we hit our peak, and then we started to climb down our peak. This right here, just to understand this one, this is from the schools. Now this one, of course, this is the tricky one, because they're really, with the exception of the schools being opened and there being no, really, I guess you could say that some of the counties have had a little bit, they're all been in moderate since this time. So I guess you could say that with compounding numbers of people being or counties being in the moderate section, and so things being open at a moderate level based on the ACDHS's guidelines, that has sort of caused this, as you can see, sort of a slow increase that went into a rapid increase. Now, one more thing to talk about with that, of course, is, and I think it's on this one, is mobility. And this is the mobility index for Arizona right now. This is, just to go through, this is what sort of would correspond with people's actions. So not just a mask order, not just this is what people are actually doing outside. So you can see this is the very beginning. This is the beginning of the stay-at-home order, where everything dropped to essentially almost no mobility. This is the duration of the stay-at-home order. This is when it was lifted. So you can see a massive jump to about 50% mobility. And then it's sort of, this is our peak. You see it got to a climb, it peaked up here, and then it gradually started to go down to about 30%. And then, as you can see, it's been sort of on a long sustained jump since that time. Now, this is very interesting. This is just from today. I didn't see this massive drop here. It's going to be interesting to see if this stays. Now, this is a average number, so it might not be here tomorrow, but very interesting to see this massive drop in mobility right here. But this really has a lot to do with everything else that's going on as well. As even with mask orders, what are Arizonans doing? When we were growing, we were almost 70% or so of our movement was going on. We were moving around about 70% of how we normally do. So that, it looks like, was causing a contributing cause to the rise in the cases. Now, if this number holds and we're starting to see decreases in mobility, we may also start to see decreases in cases. That would be an interesting thing to observe if that happens. But again, we have to just wait to see if it happens as we record numbers.
Is there any way, when we look at some of these numbers, to just measure COVID fatigue? Because we've heard a lot about that from health officials and so forth. People are just tired of this, and they're tired of it, and even people that may be committed to wearing a mask and washing their hands and doing all of the things that we've been told to do over and over and over again. At some point, people are just tired of it. They're done with it. Maybe they look in their own lives and they say, I don't know anybody that's gotten it. I don't know anybody that's died from it personally. So, at some point when you've been through something for 7 or 8 months and all of a sudden you're not seeing that around you, there's some fatigue, and you just say, I'm done doing all of this kind of stuff that I was so diligently doing several months ago. But is there, other than this mobility, measure, is there any other way to really look at how much people are actually following the rules and just doing what they're supposed to be doing according to all of the public health officials?
That's a great question, and I'm struggling to find something other than sort of the survey work we've seen. You'll see like Pew Research or some other places will put out survey work where they actually contacted residents of a state and said, what, not only are you wearing a mask, what are your thoughts on COVID-19, but what is your observations on out there as well? When you go outside, do you see people wearing masks? Are they wearing them properly? So you do see that in survey work. And I think when it comes to other than, the mobility graph is something that's at least fairly quantifiable. It's harder to quantify things like, mask wearing and, COVID fatigue. But the best way of doing that is in survey work. I'll see if I can find it for our next time. I'll have something up for that.
One of the things I wanted to look at here is the county numbers, because on Wednesday we didn't do this particular program on Facebook, but on Wednesday we got some county numbers that show that there is substantial spread in nearly all the zip codes in Maricopa County, and a lot of them have moved into that red or substantial range, which has reignited the debate over whether we should keep our schools open as much as we have done so. And when we look at this county number, these are all zip codes here.
This is essentially this is community spread. I mean, there's no other way to put it. You can see a couple of urban zip codes are in the yellow. Sun City, this one right here, 85375 is in the yellow, but just barely. This one right here, which is Sun City as well, again in the yellow, but as you can see, likely to change next week, just barely in the yellow. And this one right here, which is an extreme, there's almost no one who lives in this zip code. So you can see, again, just barely at a 95.15. So they're almost substantial as well, even though this zip code carries, the Phoenix Mountain Preserve right here, and it's a very low population zip code. So essentially every urban zip code in Arizona, or in Maricopa County, is in the red at this point. All of these zip codes surrounding Tortilla Flats, all of these, there's almost nobody in these zip codes over here. These are just basically lines drawn on a map with almost no population.
And there's also this county dashboard also breaks things down by school district, and that's one of the things that we have talked about as well. And when we look at these are unified school districts in particular, let's look at some of the ones that are open right now, because right now we've still got Mesa, Gilbert, Scottsdale, Chandler, mostly these East Valley districts that are open right now.
And we've seen pretty significant growth of the virus in the East Valley. That is something that's been very different from this particular surge from the last one in the summer, is that growth is coming from the East Valley. And back at in the original one, there was almost the virus barely had a presence in the East Valley. So that's a big difference between this. You can see Mesa, for example. This is cases per 100K in the Mesa School District, not necessarily kids, of course. This is just within the area of Mesa School District. 300 cases per 100,000 people. The percent positivity is at 13% in that district. Gilbert that's Higley, sorry. Gilbert is 328, so it's even higher than Mesa, with a percent positivity of 11.5, which is 11.3, excuse me, which is about the same.
And up until a few weeks ago, those first two numbers in the red would have, at least under the state guidelines, been enough to basically spur a recommendation that these schools close down, or that they go back to, not close down, but go back to virtual learning, not have kids in the classroom. And then the state changed the numbers. And when we look at the COVID-like illness number, no matter which school district you pop up here, that number is going to remain the same.
Yeah, that is a regional number, so that is going to be for countywide. That 6.2 is countywide.
Well, Garrett, what's interesting to me is I've been following the numbers in schools very closely. When you talk to some of these districts, they say, well, yeah, we've got a lot of spread in the district, but when you look at our numbers inside the school, we only have X number of cases, and we've only had this number, and the numbers are comparably to the surrounding districts very, very low. And what strikes me as interesting is these schools are not testing. They're not going out there and testing all other kids every day. They're not doing their own contact tracing or anything of that nature. And so when they say, well, we have very little evidence that it's actually spreading in schools, is it really statistically, mathematically even possible to have these surging numbers in the community surrounding the school, but somehow have very, very low numbers within the school? Does that make any sense to you as somebody who follows this data all of the time?
Sure. I mean, I would say in sort of obviously in a smaller school, you know, like maybe a charter school or a smaller elementary school, it makes a little more statistical sense that there would be very little cases in that kind of situation, especially in like a large area like Mesa. But when you get to larger schools, like if you're in the Gilbert school system and you're at Gilbert High School, for example, that's a massive school in a pretty large district, and with 328 cases per 100 in that area, chances are that the infection rate, or at least people that have had COVID-19 in that district, is going to be a lot higher than what you're going to see on the Gilbert Public Schools dashboard.
Somebody is challenging my contention that Scottsdale has not done contact tracing. They are notifying people that they believe have had close contacts. Contact tracing is generally done by the county. And from what we understand, the county is falling a little bit behind and starting to lean a little bit more on school nurses for some of that contact tracing, which is a difficult task to ask one school nurse when the typical ratio with school nurses, at least recommended, is about 1 in 700. So, you know, we've got one school nurse that's responsible for 700 kids. And when you look at some of these high schools as well, we're talking about high schools with anywhere from 3,000 to 4,000 kids in them at any given time. And then the district like Scottsdale, for instance, is claiming that despite the fact that they have multiple schools, that they only have 36 positive cases throughout their entire district, even though the numbers around them are different. When we look at the county numbers, though, and we look at least the population areas, it doesn't seem to make much difference, realistically, whether you're in the East or West Valley in terms of what we're seeing in spread. I mean, which might be an argument that does closing schools really matter? Because you've got, throughout Central Phoenix, for instance, it's hard to find a school district that remains open at this point. Most of them, as of this week, are going to be probably closed. We're seeing substantial spread no matter where we are, and no matter whether the school district is open or closed. Is there a correlation there?
So yeah, there is. I would say, what I would say to that is, as far as a correlation, the school districts, what was interesting about this, and I did say this, I touched on this for a moment a while ago, on how what was interesting about, you know, the first surge was we saw the cases sort of really in one single area, not really one specific area, but it was the really southwest Phoenix, where there was a real, I mean, really hot spot of COVID-19 really existed in Southwest Phoenix, and it sort of spread out from there. And the farther you got from that hot spot, the lower amount of cases you had. And so making arguments about closing schools in specific areas made a lot more sense then. But as you pointed out, Steve, this has just not been the same case at this point. I mean, there's a hotspot in every region of the valley right now. It's just that some are slightly worse than others. The East Valley is like I said, it's a hotspot. The West Valley has its own hotspot. The Southwest Valley, everywhere has a hotspot. And so at this point, does it really matter? I mean, I don't really know if it matters to close the schools or not, but I can just tell you that at this point, the spread is not localized to one single area of Maricopa County. It was at one point back in July. It is no longer. It is, as you can see with that zip code map, it is everywhere right now.
We had one comment here about Yavapai County and what's happening, and saying that cases are going up significantly in Yavapai County. We don't have quite the detailed county data that we do for Maricopa County, I don't believe, in Yavapai County, but we can at least look at some of their numbers as reported to the state health department as well. One of the fears has been that the substantial spread that we're seeing in urban areas like Maricopa County, eventually, if you see substantial spread there, you're going to see substantial spread in more rural areas and smaller towns like you're seeing in Yavapai County. Is there a spike there that's notable above and beyond any other county?
Yeah, let me. I wouldn't say beyond. I wouldn't say beyond and above other counties, but I will say that one of the other interesting aspects is at one point Yavapai. You know, again going back to the summertime, Yavapai remained almost nearly untouched from the COVID-19 pandemic at the time. Always had very low percent positivity rates, well under 5%. And in fact, before this next surge increased, when Katie and I were talking about this, we were actually saying, Greenlee had already been in minimal, and sort of Cochise and Yavapai were sort of the next ones on the list to make it to minimal. That's at least what it looked like at the time. Obviously, that's not how it happened. And that has a lot to do with what we're seeing, much higher cases per capita in the rural counties. So I'm going to bring that up really quick. And I've got all the counties here. I'll try to, this is a little hard to read, but I'll try to walk you through this. For anyone who's musically inclined, this looks like a musical sheet. I understand that. But here we go. When we look at this, we can see how, look at Apache County, how it's just shot up from less than 90 on October 11th all the way to 684. And this is done by weeks. So 684 cases per capita on November 15th. And you can see that in almost all these other counties as well. Cochise, massive spike. Coconino, pretty large spike. This one you can see, very interesting. Gila's kind of been in an up and down. Graham County, massive, huge spike in Graham County. Yavapai down here. This was, as we talked about, 40. It was at 40 in October, and now it's at 369. So huge spike for Yavapai as well. Just everywhere. In fact, Santa Cruz, as you can see, big spike there too. So a lot of movement in the rural counties right now, more so than what we have had for quite some time. There were times back again when I referenced the other pandemic, the first surge. That was a kind of a interesting. It was the north part of Arizona who was hit first, followed by the south part of Arizona, and then the center part. And then it sort of went away for a little bit. And now again, it's just kind of popping up everywhere. There's no region of Arizona that sort of gets to say, well, we've got minimal transmission right now. Pretty much even Greenlee County, which at one point in the fall had 0 active cases. It was the only county in Arizona to hit 0 active cases. And this is reported by them, not my estimate. They had reported 0 active cases, and now they're at their highest case levels they've ever had. So, it's like I said, this is different from the last time. It's not just this sort of regional pop-ups. It's everywhere in the state right now.
And when people love to try to do some sort of political overlay when they look at these numbers too, and say, well, in Republican areas or in Democrat areas or whatever, it's spiking more on one or the other, and that translates into some argument about Democrats or Republicans might handle this surge in particular better. At this point, I can't, at least from my knowledge, I and the blue and red areas a lot better than I do. It doesn't look like there's much difference in terms of what's going on in any of these areas.
Yeah, no, not anymore. I mean, there was a time when Pima County and Pima County, for anyone who doesn't know, is consistently one of the more liberal counties in Arizona. And there was a time when Pima County had very low percent positivities compared to Maricopa County, and so people were saying, "Oh, look, Pima County, they're much better with their masks. They're not running around as much as Maricopa County." But now again, none of that seems to matter at this point. Everyone's positivity rates are very high. Pima County today was higher than Maricopa County's positivity rate. Is it rural, urban, suburban? At this point, it's everywhere right now. There's nowhere is really escaping this thing right now.
And is that to be expected when you have that sort of community spread and people are mobile? That it doesn't really matter. You're not going to have an immune county or an immune community of.
Yeah, at this point, the deck's been so shuffled that it really doesn't matter. When it was starting out, we could, like I said, we could isolate it to the north of Arizona, southern Arizona, central Arizona. Even in Maricopa County, we could isolate it a little farther and say, oh, this is a community that's been hit really hard. At this point, it's all over the place. It doesn't really Republican, Democrat, it doesn't matter at this point. It's everywhere.
And so when it's everywhere, is there a point data-wise that we look at a point of no return where putting more restrictive measures in place really wouldn't do that much good?
I think that is going to be up to the hospitalization charts. I think that's the point. That's where people really talk about point of no return, because if we get into crisis standards of care, that's when you start seeing pictures that we saw back, way back when, of Italy and those places. So really, as far as the case counts are always slightly, I don't want to say disingenuous, but because so many young people are getting infected, that it could, things could explode. But we're not seeing as much hospitalizations. But if those hospitalizations continue to increase, and they start going over to 5, 4, 3% occupancy, that's a huge problem. I mean, just a huge problem. As you said, when you compound that with the fact that they can't get staff anymore from outside, then just that's a point of no return.
Yeah, some worrisome trends that we're seeing here, and hopefully we can change those around. One big way to change that around, of course, folks, is just to do the basic things: wear a mask, keep your distance from people, don't gather in large groups, wash your hands frequently, and just use some common sense, just like you would in trying to avoid the flu or anything else, because that's going to be the biggest thing that individuals can do out there. That's going to wrap up today's look at coronavirus or COVID-19 inside the numbers. We do appreciate your questions and comments. As always, we're going to continue to follow the numbers for you. We'll be here every day to run them down and give you an idea of the trends. And of course, we're going to wrap things up for you with the very latest on ABC 15 at 4, 5, 6, and 10 o'clock tonight. Thanks so much, Garrett. Appreciate it. And good to have you with us as well. Thanks so much for being with us.